Chapter 9, The Thigh. The quadriceps femoris. Attaching superiorly to the femur and the anterior superior iliac spine in the case of the rectus femoris, and inferiorly to the tibia through the patellar tendon. To strip the quadriceps, start near the knee and glide up the medial aspect of the muscle on the vastus medialis. Glide all the way up to the anterior superior iliac spine. Next, use the heel of your hand to glide up the center of the muscle over the rectus femoris and vastus intermedius, which is deep. Now use your other palm to glide up on the lateral aspect of the leg, on top of the vastus lateralis. These techniques can also be performed with your fingers. Another option is to use your thumb. To cross-fiber friction the patellar tendon, glide your thumb back and forth just superior to the patella. Now friction just inferior to the patella. To work the undersides of the patella, push the patella aside with one hand while the fingers of the other hook underneath, frictioning superior to inferior. Your pressure is towards the ceiling, the underside of the patella. Now move to the other side of the table and push the patella aside and hook your fingers under the opposite side. Friction again. The sartorius. Attaching to the anterior superior iliac spine and inferiorly to the tibial tuberosity. Use the heel of your hand to glide up the muscle, starting near the knee. The muscle actually lies in an indentation, so just follow the groove up the thigh until you reach the ASIS. You can also do this with your fingers. A thumb is another option. Hamstrings. These three muscles attach superiorly to the ischial tuberosity, and in the case of the second head of the biceps femoris, the femur, and attach inferiorly to both the lateral and medial sides of the tibia. To strip these three muscles, bend the knee, find the crease, move laterally onto the muscle, and use your palm to glide up to the ischial tuberosity. Next, start the stroke in the center of the leg, just above the popliteal space, and glide up, aiming for the ischial tuberosity again. Finally, glide up the lateral aspect of the thigh. End at the ischial tuberosity. You can also perform this technique with your fingers. To work the attachment, find the crease in the buttocks and the ischial tuberosity in the center just above. Use your thumbs to apply deep compression onto the tendon. Friction lateral to medial. Be sensitive to the fingers between your client's legs. You may want to make a fist on the inside to help with your client's modesty. The iliotibial tract is made up of the tensor fasciae lata and the iliotibial band. The tensor fasciae lata muscle attaches to the ilium and inferiorly to the iliotibial band, which then attaches down on the lateral tibia. To compress the tensor fasciae lata, find the ilium and the ASIS, move laterally and inferiorly until you're on the muscle. Use your fingertips to apply pressure into the muscle, looking for tender points. To strip this muscle, find the ilium, then apply palm pressure on the tensor fasciae lata. Glide down past the muscle and work down the iliotibial band. You can also perform this technique with a fist. Another option is to use your thumb. You can also perform this technique in side posture. Start at the greater trochanter and use your palm to glide down the band to the lateral knee. You can also use your knuckles. The adductors. These muscles attach to the pelvis superiorly and to the femur and tibia inferiorly. Find the iliac crest, move inferior and medial, and use your thumb to apply pressure. Move up until you are just inferior to the lateral edge of the pubic bone. Apply pressure on the pectineus. After that muscle has released, switch hands for comfort and apply pressure on the adductor longus, which will feel like a large tendon. Next, move even more posterior onto the gracilis and adductor magnus attachment. Another option is to use your fingertips. To strip the adductors, use your thumb to glide from the medial knee up the inside of the leg. Your second stroke is more posterior. This technique can also be performed with the leg externally rotated. You can also start more superiorly to get just the adductor brevis and longus. Another option is to use your fingertips. Another option is to use your thumbs to compress the muscle into the femur. Press and hold for a release, and once the muscle is softened, move superiorly and repeat.
To work these muscles in side posture, have your client bend their lower leg and use your thumb to glide up the adductors. You can also use your fingertips.